For more than 40 years, high blood pressure has been explained to people as if the body were nothing more than a plumbing system. Too much fluid, too much pressure, too much force pushing through the pipes. And once you hear it framed that way, the solution sounds almost obvious. Take a pill, get rid of some extra fluid, bring the pressure down, and assume the problem is under control. I understand why that way of thinking became so common. It sounds tidy. It sounds logical. It sounds simple enough to fit into a rushed office visit when there are 10 other things to discuss. But I need to tell you something plainly, and I say this from years of watching what really happens inside blood vessels over time. That model leaves out the most important part of the story, because it trains people to stare at the number and ignore the condition of the artery wall that is slowly changing underneath it. I've seen far too many people work hard to lower the reading on the monitor while the blood vessels themselves kept aging, stiffening, and breaking down out of sight. That is the part nobody explains well enough. The deeper issue is often not just the pressure moving through the pipe. The deeper issue is the health of the pipe wall itself, the inner lining, the flexibility, the tiny injuries, the quiet inflammation, the slow structural damage happening in places no regular blood pressure cuff can show you. And once you understand that, the whole picture starts to look very different. Because when the artery wall is inflamed, less elastic, slowly calcifying, and no longer functioning the way it was designed to, lowering the pressure is not the same thing as correcting the damage. It is more like turning down the water pressure in an old house while the pipes behind the wall are still rusting and weakening. The sink may seem calmer, the sound may be softer, but the damage in the system may still be moving forward day after day. Have you ever noticed how many people do exactly what they were told and still feel like they are losing the battle? They cut back on salt. They take the medication every morning. They try to walk after dinner. They try to lose a little weight. They skip foods they enjoy. They do their best to be responsible, and then the numbers stay stubborn, or swing around, or never seem to settle the way they hoped. After a while, many of them start blaming themselves. They start asking quietly and painfully, "What am I doing wrong?" And in many cases, the most honest answer is this: you were trying to solve a problem without ever being shown where the real damage was happening. That is why this matters so much, because high blood pressure is often not just a fluid issue. It is often a blood vessel issue, a lining issue, a signaling issue, a structure issue, a slow damage issue that may have been building in the background for years while life was busy, while symptoms were vague, and while the cuff still had not given you a number dramatic enough to make you worry. So in this video, I want to walk you through the 3 hidden mechanisms that may actually be driving this process, and then I'm going to show you the 4-step strategy that helps address the root of it, not just the surface reading. And once you see that first hidden mechanism, I think you'll understand something most people are never told soon enough. The real damage often starts long before the blood pressure machine finally reveals it. This is where a lot of people get led in the wrong direction. They start believing that if the blood pressure number comes down, then the real problem must be improving too. But those two things are not always the same. A blood pressure cuff is a very limited instrument. It measures force. That is what it does. It can tell you how hard the blood is pressing against the artery wall at that particular moment, but it cannot tell you whether the inner lining of that artery has been injured, whether the wall has become stiff and less flexible, whether the kidneys are being signaled to hold on to sodium, or whether the body has lost some of the nitric oxide signaling that helps blood vessels relax the way they should. So yes, it can measure the pressure, but it cannot show you the cause. And that difference is much bigger than most people realize. I've watched people become emotionally tied to that reading in a way that is almost painful to see. If the number is lower, they feel relieved for the rest of the day. If it is higher, they feel defeated, as if they did something wrong, as if they somehow failed their own body. But blood pressure is often a downstream signal. It is often the smoke you can see, not necessarily the fire that started everything. Let me put it in a simpler, more everyday way. If you have an old pipe in your house that is corroded inside, you can turn down the water pressure going through it. And yes, that may reduce some immediate strain. It may make the system seem calmer for the moment. But if the lining is already damaged, if the wall is rough, irritated, inflamed, and slowly hardening over time, then the deeper problem has not really been repaired. You changed the force moving through the pipe, but you did not truly restore the pipe itself. And that is exactly where the old blood pressure model starts to fall apart. I remember one patient very clearly, extremely disciplined, the kind of person doctors wish every patient could be. Took the medication exactly as prescribed, cut down on salt, showed up for follow-ups, tried to do everything right. And on paper, the readings looked better than they had before. Anyone glancing quickly at the chart might have said, "Good, this is moving in the right direction." But underneath that improvement, the vascular system was still aging in a harmful way. The arteries were becoming stiffer. The metabolic strain was still there. The deeper dysfunction had not truly been corrected. So the numbers looked more comforting than the biology actually was. I want you to really let that sink in, because it explains why so many people feel confused, discouraged, and even a little betrayed. They start thinking, if the reading came down, why do I still feel like something is not right? Why does it keep creeping back up? Why is the top number still so stubborn? Why do I feel like I'm trying so hard and still not getting where I want to go? And often the answer is this: you may be treating the expression of the problem without yet reaching the source of it. Now, that does not mean blood pressure medication is useless, and I want to be very careful and very fair about that. It can absolutely reduce risk. It can help create a layer of protection. It can act like a safety buffer while bigger changes are being addressed. But what it does not automatically do is rebuild a damaged artery wall or reverse the deeper processes that helped create the problem in the first place. And once you truly understand that, you are ready to look where the real story often begins. Inside the hidden world of the artery wall itself, where the earliest damage can be so tiny, so quiet, and so invisible that most people have no idea it is happening until years have already passed. Now let me show you the first hidden cause, because in my experience this is one of the most important parts of the blood pressure story, and also one of the parts almost nobody talks about. Inside every blood vessel in your body, there is a microscopic protective layer called the glycocalyx. Most people have never heard that word before. It almost never comes up in normal conversations about high blood pressure. It is not the kind of thing people discuss over breakfast, or hear explained clearly during a rushed appointment. And yet this tiny layer plays a major role in whether your blood vessels stay smooth, calm, and responsive, or slowly become irritated, inflamed, and much more vulnerable. I want you to picture it like a Teflon coating inside a pipe, or maybe even more vividly, like a soft velvet lining inside something delicate and valuable. It is unbelievably thin. You cannot see it with your eyes. You cannot feel it. Most people go through life never knowing it exists, but it matters far more than people realize. This layer helps blood move through the vessel smoothly, without rubbing, scraping, or sticking to the wall. It acts almost like a cushion. It softens friction. It helps control what comes into contact with the vessel wall and what stays away from it. And just as importantly, it helps send the chemical messages that tell the artery when to relax and when to stay calm. That is the part most people never hear. A blood vessel is not just a hollow tube with blood passing through it. It is living tissue. It is active tissue. It is a signaling surface that is constantly communicating. And when that surface starts to break down, blood pressure can begin drifting upward long before someone understands what is really going on. So what actually damages this lining? One of the biggest offenders is repeated blood sugar spikes. And I want to be very clear here. I am not talking only about advanced diabetes. I am not talking only about someone being told their labs are dangerously high. I'm also talking about the quieter, repeated surges that happen after everyday foods people barely think twice about. Refined carbohydrates, white bread, white rice, sweet drinks, desserts, packaged snacks, and ultra-processed foods that seem harmless because they are so common. Add oxidative stress, ongoing inflammation, poor sleep, daily stress, and metabolic strain, and this delicate protective layer starts getting worn down little by little. And once that happens, the vessel wall is no longer protected the way it should be. It becomes exposed. And an exposed vessel wall is not peaceful. It becomes irritated. It becomes sticky. It becomes inflamed. It becomes more fragile, less protected, and less able to release the relaxation signals that help blood flow stay steady and smooth. Instead of blood moving through a healthy, well-lined surface, It starts moving through a system that is rougher, more reactive, more sensitive, and more likely to stay tense. I saw this pattern in one patient who kept being reassured, "Your fasting sugar looks normal, so that probably isn't the problem." But the blood pressure would not settle. It stayed stubborn. And when we stepped back and looked at the full picture, the real problem was showing up after meals, not just on a fasting lab. Repeated spikes, repeated stress, repeated injury to the vessel lining day after day. The blood pressure cuff was only catching the final result. It was not showing the microscopic damage that had been quietly developing for years, while life went on as usual. And this is where the body starts making a dangerous compromise. When the vessel loses part of its ability to regulate itself properly, the system often tries to compensate by raising pressure. It is the body's way of trying to maintain circulation through a damaged environment. In the short term, that may help preserve flow, but over time, that compensation creates a price the body has to keep paying. So let me ask you something very honestly. What if your blood pressure problem began years before the cuff ever noticed it? Because once you understand how this invisible lining gets stripped away, you are ready to understand the next stage of the story. What happens when the artery no longer acts like soft, flexible living tissue and starts becoming something much harder? Now let's talk about the second hidden cause, because this is the pattern I see over and over again in older adults whose top blood pressure number keeps creeping higher even though they feel like they are doing everything they were told to do. They cut back on salt. They try to stay calm. They take the medication faithfully. They avoid stress when they can. They try to be careful at family dinners, careful at the grocery store, careful with their routines. And yet the systolic pressure, the top number, still stays high, or keeps inching upward in a way that feels confusing and discouraging. Why does that happen? Because sometimes the real issue is not tension. Sometimes the real issue is stiffness. A healthy artery is not meant to behave like a hard, rigid pipe. It is supposed to be living tissue. It is supposed to be flexible, resilient, and responsive. Each time the heart beats, a healthy artery expands a little and absorbs some of that pressure wave. It has some give to it. It is more like a garden hose with softness in the wall than a hard tube that resists everything. It does not fight every heartbeat. It receives the force, stretches slightly, and helps smooth the flow forward. But when an artery has been under silent inflammation for years, the structure begins to change. The body starts laying down calcium inside the vessel wall. And little by little, that artery begins to lose what made it healthy in the first place. It loses softness. It loses flexibility. It loses elasticity. It stops acting like a living hose and starts acting more like a concrete pipe. And when that happens, each heartbeat hits differently. Instead of the artery stretching and cushioning the wave, the heart is now pumping into a wall that barely gives it all. The force has nowhere to be absorbed, nowhere to soften, nowhere to spread gently. So that wave pushes harder straight into the pressure itself, and the top number rises, sometimes slowly, sometimes dramatically, sometimes in stubborn little jumps that leave people frustrated, sometimes in people who say with total sincerity, "I don't understand this. I'm not even that stressed." And in many cases, they are right. Because at that point, this is no longer just a stress story. It is a structure story. It is a materials story. I have opened chests. I have seen what years of quiet vascular damage can do to the body. And one of the most troubling things about arterial stiffness is how silently it changes everything. It does not usually arrive with some dramatic warning. It does not knock on the door and announce itself. It just slowly alters the entire mechanical environment inside the body. The heart has to push harder. The vessels absorb less. The pressure wave moves with more force. The circulation becomes harsher. And over time, the body begins aging under a very different kind of internal stress. That is why so many older adults notice that the top number keeps drifting upward, while the bottom number does not always rise the same way. The system has lost part of its shock absorption. It has lost some of its ability to soften the impact of each beat. And here is what many people are never told clearly enough. Standard blood pressure medication may absolutely help lower the reading, and that can be very important for safety, but it does not scrape calcium out of the artery wall. It does not magically turn hardened tissue back into something youthful and elastic overnight. It does not automatically restore flexibility that was lost slowly over years, sometimes over decades. So if all your attention stays fixed on the reading alone, it becomes very easy to miss the deeper story. Because the real question is not only, how high is the pressure? The deeper question is, what kind of wall is that pressure crashing into? If the wall is hardening, are you treating the number, or are you dealing with the material of the wall itself? And once that clicks into place, the next hidden cause becomes much easier to understand, because now we have to talk about the chemical signals that quietly tell the kidneys to hold on to salt even when someone feels like they are doing everything right. Now we come to the third hidden cause. And this is the point where many people start feeling genuinely frustrated, sometimes even discouraged. They cut back on salt. They stop reaching for the salt shaker. They buy the low-sodium version at the store. They read labels. They try to make careful choices at breakfast, lunch, and dinner. They do their best day after day. And still, the blood pressure stays high. So after a while, many of them turn the blame inward. They think, I must be missing something. I must be doing this wrong. But here is what most people were never clearly told. Salt is not always working alone. In many cases, the bigger issue is the hormonal signal that tells the kidneys what to do with salt after it enters the body. And one of the strongest signals in that entire process is insulin. When insulin stays elevated too often, because of frequent refined carbohydrates, constant snacking, processed foods, sweet drinks, desserts, or ongoing insulin resistance, the kidneys receive a very clear message. Hold on to sodium. Do not release it easily. Keep it in the system. And that matters because sodium never works alone. Water follows it. So when the kidneys hold on to more sodium, they also hold on to more water. Blood volume starts to rise. The circulation carries more fluid, and the pressure inside that system begins to climb. Not because you sprinkled a little salt on your food one evening, not because you made one bad choice at dinner, but because the body has been receiving the same instruction again and again: retain, hold, do not let go. That is why some people can eat a very strict low-salt diet and still feel confused by stubborn blood pressure. They are focusing on the seasoning, but the deeper signal is still running in the background. And then fructose makes the whole situation worse. I do not mean a few bites of fruit as part of a normal, healthy meal. That is not what I am talking about. I am talking about the concentrated fructose that shows up in sweetened drinks, packaged snacks, flavored yogurts, syrups, dessert coffees, bottled smoothies, and ultra-processed foods that wear a healthy label on the front, but create a very different effect inside the body. As fructose intake rises, uric acid can rise with it, and when uric acid goes up, nitric oxide can go down. When nitric oxide drops, blood vessels lose one of their most important signals to relax and open properly. On top of that, the kidneys become less efficient at handling sodium the way they should. So now the body gets hit from both directions. The blood vessels are less able to relax, and the kidneys are less willing to let sodium go. I remember one patient who kept telling me very sincerely that she was eating healthy. And in her mind, she was trying. She had cut out the obvious junk food. She was not eating fast food every day. She was not adding much salt to her meals. But when we looked closely at what her days actually looked like, a different story appeared. Orange juice in the morning, granola bars in the afternoon, sweetened yogurt, packaged convenience foods between errands, foods that looked innocent, drinks that felt normal, snacks that never felt extreme. On paper, it did not look like a high-salt lifestyle. But in reality, it was a high-signal lifestyle. Constant insulin stimulation, repeated fructose exposure, and a body that kept being told to store, retain, and tighten. That is the key point I want you to hold on to, because it changes how this whole problem makes sense. This is not just a seasoning problem, it is a signaling problem. And once you start to see that clearly, the blood pressure story stops feeling so random. It stops feeling like a mystery. It stops feeling like you are being punished by numbers for no reason. Because now we are looking at the level where the bad instructions are actually being sent and where the damage is really being reinforced. And that is exactly where we turn next, away from hidden causes and toward the first practical steps that can help the vessel wall begin to recover. So now let's move from damage to repair, Because this is the part most people almost never hear clearly enough. The body is not powerless. And I want to say that with real conviction because I've seen blood vessels behave like injured tissue, not lifeless tissue. There is a difference. Injured tissue can respond. Injured tissue can settle down. Injured tissue can begin to recover when you stop hitting it with the same harmful signals day after day, meal after meal, habit after habit. That is where step 1 begins. Stabilize blood sugar so the glycocalyx, that delicate protective lining inside the vessel, finally has a chance to repair itself. And that means being honest about the foods and drinks that keep scraping at that lining over and over again. Refined starches, sugary drinks, white bread, white rice in excess, desserts that hit the bloodstream fast, packaged foods that seem small but create repeated spikes. And liquid sugar is especially damaging because it moves fast. It does not ask permission. It rushes in, creates a sharp surge, and forces the body to absorb the impact all at once. Have you noticed how often people say, "But I really don't eat that badly," while still drinking fruit juice in the morning, sweet coffee in the afternoon, bottled smoothies on the go, or snack foods that are sold as healthy because the label looks clean and the packaging uses words like natural or wholesome? But the vessel wall does not respond to the label. It responds to the chemistry. What helps instead are foods that create a calmer internal environment, a less hostile environment, a better repair environment. Dark berries, leafy greens, extra virgin olive oil, dark chocolate with a high cacao content. Foods rich in polyphenols that help lower oxidative stress and protect the inner lining of the vessel. I want you to think of these as part of the repair crew. They are not magic. They do not perform miracles overnight, but they help change the conditions inside the body so the glycocalyx is no longer being constantly stripped, irritated, and pushed backward every single day. And that matters, because healing does not start when you find one perfect pill or one perfect supplement. Healing starts when the body finally stops receiving the same damaging instructions from morning to night. Now let's go to step 2. Slow the hardening and help move calcium where it actually belongs. Because calcium itself is not the enemy. The real issue is location. You want calcium in your bones. You do not want calcium settling into the artery wall like hard mineral buildup forming inside an old household pipe. One of the important tools in this process is something called matrix GLA protein. Let me make that simple. Think of it like a traffic director for calcium. Its job is to help guide calcium away from soft tissues like the arteries and toward the places it is meant to go, especially bone. But that traffic director cannot do its job well without vitamin K2, especially the MK7 form. That is why so many people focus only on calcium and vitamin D while missing a major part of the signal system that helps determine where calcium actually ends up. So the support trio I want you to understand is vitamin K2 MK7, magnesium glycinate, and vitamin D3. Not as some miracle shortcut, not as false hope, not as a fantasy cure in a bottle, but as a coordinated support system that may help the body handle mineral placement and vascular tone in a smarter, more balanced way. Magnesium matters too because it helps the vessel wall relax. And relaxed tissue behaves very differently from tissue that stays tense, irritated, and under strain. Then add potassium-rich foods into the daily picture: sweet potatoes, spinach, white beans, avocado. Potassium helps the kidneys release excess sodium, and that takes pressure off the whole system in a very practical way. This is the mindset shift I really want you to remember. You are not trying to force the body into health. You are not trying to punish it into better numbers. You are trying to give it better raw materials, better signals, and fewer reasons to keep damaging itself. And once that process truly begins, we can move to the next step, restoring one of the most powerful natural vessel opening signals your body was designed to produce. Now let's finish this repair plan with two of the most powerful tools most people are almost never told to think about. Step 3 is restoring nitric oxide. Nitric oxide is tiny, but its job is enormous. It is one of the body's natural signals that tells blood vessels to open, soften, and relax. In a healthier system, it helps the arteries stay flexible, responsive, and able to handle blood flow without so much resistance. But with age, nitric oxide production often drops. And when that happens, the vessels stop acting like relaxed, living tissue and start acting more like tense tubing that has forgotten how to open the way it once did. I have seen this pattern again and again. People are often told to think only in terms of blockage or stiffness, as if those are the only two possibilities. But sometimes the problem is quieter than that, and easier to miss. Sometimes the vessel has simply lost part of the chemical signal that tells it how to relax. So the question becomes, how do you support that signal? One practical way is isometric hand grip training, about 3 to 4 times a week. It does not look impressive. It is not dramatic. It is not the kind of exercise people brag about. But steady gripping work creates a controlled, sustained signal that can encourage healthier vascular responses over time. And I think that is exactly why so many people overlook it. It seems too simple, too ordinary, too easy to be meaningful. But simple does not mean powerless. Then we need to talk about breathing. A lot of people go through most of the day breathing through the mouth without even realizing it. They do it while walking, while sleeping, while watching television, while doing chores around the house. But mouth breathing tends to push the body in the wrong direction. Nasal breathing helps support nitric oxide production in a way many people never hear about. The nose is not just a hole for air to pass through. It is part of the body's signaling system. So if someone is spending large parts of the day and night breathing mostly through the mouth, they may be missing one of the most basic and natural ways to support blood vessel function. And there is something else that deserves a warning here. Antiseptic mouthwash. Used once in a while for a specific reason, that is one thing. But using it constantly can wipe out helpful bacteria in the mouth that participate in the pathway that helps produce nitric oxide. In plain English, you may be sterilizing away part of the chemistry your body depends on to help blood vessels relax. Now let's move to step 4. Break the insulin kidney trap. One practical way to begin is with a 16-8 intermittent fasting rhythm. 16 hours without food, followed by an 8-hour eating window. Why can that help? Because when insulin stays elevated from morning until night, the kidneys keep receiving the same message over and over: hold on to sodium, do not release it. But when insulin has time to come down, the kidneys finally get more room to do the opposite. Then add 2 to 3 light strength sessions each week. Wall push-ups, resistance bands, chair squats, maybe light movements between meals. Nothing punishing, nothing extreme, nothing that leaves you feeling broken the next day. Muscle is one of the biggest glucose sponges in the entire body. When you use it regularly, it helps pull glucose out of the bloodstream more effectively and improves insulin sensitivity over time. And that is the real key here. Not intensity, consistency, not occasional bursts of motivation, not one perfect week followed by 3 distracted weeks. Consistency, because blood vessels do not heal from occasional heroics. They improve when the body receives better signals often enough, steadily enough, and long enough for that change to actually matter. And now we come to the most important part of all: how to do this safely without making the dangerous mistake so many people make the moment they finally start seeing things improve. So, let me leave you with the truth I wish more people understood before they spent years staring at a blood pressure reading, worrying about that one number, and never being shown the deeper story unfolding underneath it. High blood pressure is often not just a fluid problem. Very often, it is a blood vessel damage problem. It is a vessel lining problem, a stiffness problem, a signaling problem, a slow structural problem that can be developing quietly in the background for years, while life is busy, while symptoms are easy to dismiss, while people are still cooking dinner, running errands, caring for family, going to work, and trying to live normally, long before the cuff ever gives a number high enough to frighten them. But here is the hopeful part, and I really want you to hold on to this. The body can improve. It is not always fast. It is not always dramatic, but it can improve. And when you start giving the body better signals, better raw materials, steadier blood sugar, better support for the vessel wall, healthier breathing patterns, and real periods of metabolic rest, you are doing something much bigger than chasing a reading on a screen. You are creating a better environment for repair. You are giving the body a more favorable setting in which healing can actually begin. Now I need to say something very clearly, because this is where people can make a serious mistake. Never stop or reduce your blood pressure medication on your own. Do not do that. Those medications may be acting like a safety net while the deeper repair work is happening underneath the surface. They are not the enemy. In many cases, they may be helping protect your brain, your heart, your kidneys, and your blood vessels while you work on the root causes in a smarter, steadier, and more complete way. So please do this the right way. Check your blood pressure at home. Write the readings down. Bring those numbers with you. Bring this framework with you too. Sit down with your doctor and have a real conversation about what may be driving your blood pressure beneath the surface, beyond salt, beyond stress, beyond the simple explanations many people have been given for years. I've seen too many good people blame themselves for a number without ever being told what was actually happening underneath. And that has to change. So tell me in the comments, which hidden cause surprised you most, and which repair step do you feel ready to start with first? And please share this with someone who still believes blood pressure is only about salt, stress, and getting older. This content is for education only. It is not personal medical advice. Do not stop, start, or change any medication without speaking with your physician. Always consult your own doctor, especially if you have heart disease, kidney disease, diabetes, dizziness, fainting, or a history of stroke.